Hi, I'm Dr. Bomer. Welcome to my anti-aging series. Today I'm going to talk about chemical peels, a powerhouse for skin rejuvenation. Often we think about lasers first because they're very heavily marketed, but chemical peels have been with us for many, many years and truly rejuvenate skin. They're often less expensive, so they're a really great option. So why do chemical peels work? Well, what they're doing is they're harnessing our skin's ability to heal itself. They digest some of the protein, which is the outer layer of the skin, away, and then that ends up flaking off afterwards. And then we regenerate new skin. When we generate new skin, we're making new collagen, new elastin, new hyaluronic acid, and we end up with plumper, brighter, smoother skin. And also some of the pigmentation that has the melanin that has deposited in our skin gets lifted out, and we have improvement in the pigmentation as well for a more even skin tone. And so some of the acids that are used are glycolic, alpha hydroxy acids, vitamin C, salicylic acids. All of these you're familiar with, and they're in our skincare products, but within a chemical peel, the concentration is higher so that we get a little bit deeper into the skin and actually cause some peeling and get that beautiful renewal of new tissue that turns us into having a thicker dermis and a more compact epidermis, which is basically more similar to the 20-year-old skin that we wish we had. So how do we best prepare ourselves for a chemical peel? Well, first of all, it's important to realize that after most chemical peels, we will experience some flaking, except for the glycolic peels. They're really a lot easier because you don't tend to flake. And so you need to think about sun exposure, even with a glycolic peel, because you don't want to expose your peeling, fresh skin, which is in the healing phase, to sun where it's going to get damaged. And also, if you are going to be flaking, you need to take into consideration your schedule socially and what you want to do, and just plan a time where you have a few days to do some flaking and not feel uncomfortable. And so in terms of preparing our skin for a peel, it is very important to have the very best results, to have your skin prepared for peeling. And what that means is you have been on a medical grade skincare program which has already started that healing phase. You've already upregulated your production of collagen, your elastin, your hyaluronic acid, and you're regenerating new skin. You're making new skin at a faster rate. And then when you introduce a chemical peel to your skin in that state, you're going to heal faster, your pigmentation is going to be more controlled and lifted from the peel as opposed to causing irritation, and you're going to have a much better result. So how do we choose the best peel for us? Well, the reality is pretty much it's difficult for us to understand as lay people what peel is going to be best for the skin. So you really are going to do you're going to have the best result in the hands of a very experienced medical esthetician. And medical estheticians that are very experienced often are working with cosmetic dermatologists and cosmetic surgeons. And your esthetician will have talked to you about your skin prep, the products that you've been on. It's important to be on the medical grade skincare products for at least 1 month prior to engaging in a peel. And then if it's your first peel, the best type of peel is to go very light. And so peels can be of different depth. And when an esthetician is first starting peels with you, it's important that she or he starts to first understand how your skin responds to the treatment. And the safest way is to start off light, and then as you continue down the road, you can gradually increase the strength of the peels. So chemical peels in general are categorized by the depth of penetration. So we have chemical peels that are very light, which just exfoliate some of the epidermis, and they can go to the mid epidermis. And so light peels basically are dealing with the epidermis, and then we can go up to a medium depth peel, which is going to also reach the superficial layer of the dermis. In my opinion, this is the range where peels should stay. The deeper peels that go into the deeper dermis, the middle layer of the dermis and the deep dermis, really have a bit more risk associated with them. That's when you can have issues with damaging your melanocytes, which are responsible for making the pigmentation in your skin, and you can have areas of hypopigmentation or whitish areas. And you can also have problems with damaging the melanocytes so that they hyperpigment and you have more pigmentation from a peel. So this is my opinion, it's really safer and you can get great benefit from repetition of light chemical peels and then interjecting some medium depth peels throughout the year. So what's a good rhythm with chemical peels? For the light chemical peels, and that's more often what you're going to be doing, a great rhythm while you're on medical grade skincare is to do a light chemical peel once a month. And then the medium depth peels, which are a little bit more cumbersome to heal from, in other words, the peeling is a little bit more intense, it's really good to do those at least every 4 months. You want to do it at least 2 times a year. And that's going to really keep your skin in the regeneration phase and keep you on that path of youthful skin. And so how much time do you need to set aside for healing from a peel? As I mentioned before, the glycolic peels, you can pretty much get away with not needing to change your social schedule because you're going to look pretty good. You will look better once the effects of the peel have fully come on, which is about 7 days. But some of the lighter peels that cause flaking, you need to set aside about 2 to 3 days for that flaking period, and then you're going to be good for social events. And a medium depth peel, you're going to need to reserve more of a week's time before you're comfortable in a public event. And at the end of that time, your skin's going to really be plump and blossoming, and it's really fun to celebrate that. So as an overview, chemical peels are a wonderful way to rejuvenate your skin. A good way to think about it is that you want to have it done repetitively and not ever really get too aggressive. Skin is a delicate creature and we don't want to hurt it too much. We want a controlled injury that's not too aggressive. And again, you can achieve this in the hands of a very experienced medical esthetician. And we need to remember that laser treatments, while they can be effective, they can also be too aggressive. They can leave us with scarring, unnatural looking skin that looks kind of waxy white, and they can leave us with irregular textures. So it really one needs to respect our skin, go gently, go repetitively, don't increase your risk, just be consistent and you're going to have that beautiful skin you're searching for. So you all might be wondering, so what's it feel like when you're having the peel? Does it hurt? Is it difficult to get through? Well, that's also one of the reasons you want to start light, so you start to understand what the sensation is on your skin. And then as you are doing them more frequently, you get used to the sensation. So some of the things that what you feel when you're having a chemical peel is itchiness, burning, stinging, and also warmth. And depending on the depth of the peel, the deeper the peel, the more you have of that going on. I've been doing chemical peels for many, many years. For me, it is a workhorse for rejuvenating my skin. And I can say from personal experience that you really gain understanding and ability to weather a peel, to get through it. And it really is just, it's temporary and the pain goes away. It's not that bad. And it's very easy to do over and over. And so remember, all of this can be done on the body too. Body skincare, body peels, body Rejuvenate, body photofacials. Our whole skin can be rejuvenated and fight that intrinsic aging, genetically programmed aging, and also the aging that we're experiencing from the sun and pollution. We can work at reversing this. And so I'm really active with it. I'm very excited about trying to maintain youthful and healthy looking skin, and I hope you are too. I hope you enjoyed this overview of chemical peels, and if you have any questions, please don't hesitate to contact us.